Praxis Practice Exam 200 Questions and Answers. Flashcard 1. You perform an oral mechanism examination on a client. You ask him to stick his tongue out. When he is sticking out his tongue, you notice that it deviates toward the left. Since tongue musculature is paired, this means your client probably has a weak A. Right genioglossus B. Left genioglossus C. Right hyoglossus D. Left hyoglossus. Pause and think of the answer before the reveal. The answer is B. Flashcard 2. Anthony, a 40-year-old, has been diagnosed with Wallenberg syndrome after suffering from a cerebral vascular accident. Based on the diagnosis, you should expect Anthony to have damage to which part of his brain? A. Frontal lobe B. Brainstem C. Temporal lobe D. Cerebellum. Pause and think of the answer before the reveal. The answer is B. Flashcard 3. Before a surgeon performs a type V total glossectomy, she mentions to the speech-language pathology that all of the mobile tongue, including the base of the tongue, will be transected at the level of the valleculae. She also informs the clinician that the blank nerve will be transected. A. Cranial nerve X, vagus nerve B. Cranial nerve Roman 9, glossopharyngeal nerve C. Cranial nerve Roman 12, hypoglossal nerve D. Cranial nerve Roman 7, facial nerve. Pause and think of the answer before the reveal. The answer is C. Flashcard 4. What are cartilages that are cone-shaped and are located at the posterior of the ariepiglottic folds and are occasionally fused with the arytenoid cartilages? A. Cricoids B. Laminas C. Cuneiforms D. Corniculates. Pause and think of the answer before the reveal. The answer is D. Flashcard 5. List the parts of the brainstem from superior to inferior. 1 midbrain, 2 cerebellum, 3 medulla, 4 pons. Pause and think of the answer before the reveal. The answer is 1, 4, 3. Flashcard 6. Choose that statement that best explains the difference between the valleculae and the piriform sinus. A. The piriform sinus is the space between the thyroid cartilage and ariepiglottic membrane, and the valleculae is the space between the tongue and epiglottis. B. The piriform sinus is the space between the tongue and epiglottis, and the valleculae is the space between the thyroid cartilage and ariepiglottic membrane. C. The piriform sinus is the space between the two ventricular folds, and the valleculae is the space between the two thyroarytenoid muscles. D. The piriform sinus is the space between the hyoid bone and thyroid cartilage, and the valleculae is the space between the thyroid cartilage and cricoid cartilage. Pause and think of the answer before the reveal. The answer is A. Flashcard 7. The function of the blank is to allow optimum contraction and expansion of the lungs during breathing. A mediastinum B bronchioles C alveoli D pleura. Pause and think of the answer before the reveal. The answer is D. Flashcard 8. A 52-year-old patient visited a laryngologist and complained of lingering hoarseness that lasted over 2 weeks and voice changes which included a low, raspy voice, chronic cough, discomfort while swallowing, and post-nasal drip. She informed the physician that she was in no pain but mentioned that she talked loudly, smoked, drank alcohol heavily, had gastroesophageal reflux disease GERD, and was often exposed to dust at work. The physician's diagnosis was A. laryngeal web, B. vocal nodules, C. polyps, D. chronic laryngitis. Pause and think of the answer before the reveal. The answer is D. Flashcard 9. The components of an AAC system are crucial to consider during an assessment. When assessing a young child, you evaluate the way the individual will use and interact with the system, including the user interface, selection method, and output. What type of components are being described? A primary components B, secondary components C, tertiary components D, global components. Pause and think of the answer before the reveal. The answer is B. Flashcard 10. Which type of client would most likely benefit from a neuro-assisted augmentative and alternative communication AAC device? A. A client with primarily verbal communication. B. A client with profound motoric impairments. C. A client who is able to use a manual switching device. D. A client choosing American Sign Language as his or her primary language. Pause and think of the answer before the reveal. The answer is B. Flashcard 11. Which of the following therapies focuses on methods that can be integrated into the child's natural environment and targets supportive relationships, daily routines and structure, life events, socialization, self-care, and creating supportive environments for clients? A. Milieu therapy. B. Group therapy. C. Personalized therapy. D. Sensory feedback therapy. Pause and think of the answer before the reveal. The answer is A. Flashcard 12. In general, augmentative and alternative communication AAC symbols and techniques may be divided into which of the following two categories? A. Aided. B. Unaided. C. Rated. D. Independent. Pause and think of the answer before the reveal. The answer is A and B. Flashcard 13. Which selection technique involves the user selecting the desired symbol S through either physical touch, for example using a finger, or generated activation, for example eye gaze or joystick? A. Indirect selection. B. Direct selection. C. Scanning. D. Partner-assisted scanning. Pause and think of the answer before the reveal. The answer is B. Flashcard 14. Which of the following is not true about the fringe vocabulary set of an augmentative and alternative communication device? A. It includes words that occur frequently in typical speech. B. It typically includes nouns. C. It includes vocabulary specific to the individual. D. It may include names of people or places. Pause and think of the answer before the reveal. The answer is A. Flashcard 15. Individuals who use augmentative and alternative communication AAC need to be able to select icons on a device. What type of selection technique involves activating a switch to make a selection while the device sequentially presents each option? A. Direct selection. B. Scanning. C. Encoding. D. Fingerspelling. Pause and think of the answer before the reveal. The answer is B. Flashcard 16. Those who communicate with augmentative and alternative communication AAC should build their skills to support and increase interaction. This type of training, which consists of education on modeling, prompting, and weighting, is known as A. Professional training. B. Communication partner training. C. Developmental training. D. Incidental teaching. Pause and think of the answer before the reveal. The answer is B. Flashcard 17. Assessment for individuals being considered for ACC should include all of the following except A. Augmentative means of communication to facilitate natural speech. B. Alternative means of communication to replace natural speech or writing. C. Temporary or permanent need for AACD. The speed at which a person can use an AAC device. Pause and think of the answer before the reveal. The answer is D. Flashcard 18. What type of display allows the user to access a large amount of vocabulary in one device, uses spell-in to convey the message, is changeable by the user, depicts language in electronic form, uses context-based pages, and uses conversational pages? A. Static. B. Hybrid. C. Dynamic. D. Synthetic. Pause and think of the answer before the reveal. The answer is C. Flashcard 19. Which of the following types of communication requires no additional equipment and only requires the individual's own body as the mode of communication? A. Unaided communication. B. Aided communication. C. Rated communication. D. Independent communication. Pause and think of the answer before the reveal. The answer is A. Flashcard 20. Which of the following is a behavioral method of teaching that fades the use of prompts during instruction? A. Language intervention. B. LSVDC. Behavioral management. D. Time delay. Pause and think of the answer before the reveal. The answer is D. Flashcard 21. Clyde, a 72-year-old man with Parkinson's disease, has a reduced range of movement of his upper limbs due to rigidity. How will his reduced range of movement affect the size of the selection display of an augmentative and alternative communication AAC device? A. The size of the selection display will need to be increased. B. The size of the selection display will need to be reduced. C. The size of the selection display will stay the same. D. The size of the selection display will not be impacted because this individual does not qualify for AAC. Pause and think of the answer before the reveal. The answer is B. Flashcard 22. Initial training with an AAC device often begins with teaching an individual how to express wants and needs, gain attention, indicate preferences, and protest. These skills are considered a functional communication skills. B. Incidental teaching skills. C. Facilitated communication. D. Augmented input. Pause and think of the answer before the reveal. The answer is A. Flashcard 23. A clinician is evaluating a 12-year-old boy, Justin, who was in a car accident and sustained a traumatic brain injury. He is now having difficulty communicating and has complex communication needs. The clinician is attempting to determine which type of alternative/augmentative communication AAC technology to use with him. In evaluating Justin's willingness to use this technology, she must consider response efficiency, which involves equality, rate, and immediacy of reinforcement, as well as response effort. B. The speed at which Justin can press keys on the AAC device. C. Whether or not a device's symbols are transparent. D. Whether or not a device's symbols are opaque. Pause and think of the answer before the reveal. The answer is A. Flashcard 24. The classification of unaided symbols can be separated into which of the following two categories? A. Object-based. B. Arbitrary logographs. C. Linguistic. D. Alphabet-based symbols. E. Arbitrary shapes. F. Non-linguistic. Pause and think of the answer before the reveal. The answer is C and F. Flashcard 25. Unaided AAC can consist of all of the following except A. Gestures. B. Facial expressions. C. Verbalizations. D. Writing. Pause and think of the answer before the reveal. The answer is D. Flashcard 26. Which of the following factors is most important when designing an augmentative and alternative communication AAC system for individuals with progressive supranuclear palsy? A. Rigidity involving upper limbs. B. rigidity involving lower limbs C. Visual impairment D. Hearing deficits. Pause and think of the answer before the reveal. The answer is C. Flashcard 27. A speech-language pathologist in a rehabilitation setting is treating an adult. The goal of the clinician is to have the adult use a communication device to make sentences with the correct use of various basic grammatical concepts when describing a set of pictures. This is an example of which of the following goals? A. Long-term goal B. Unrealistic goal C. Isolated goal D. Integrated goal. Pause and think of the answer before the reveal. The answer is C. Flashcard 28. Which one of the following statements is false? A. Non-iconic symbols are geometric, abstract, and arbitrary and must be specifically taught. B. The picture exchange communication system PEX is effective. C. A hieroglyphic picture of a house is an iconic symbol indicating the word house. D. Indirect selection. The user is offered available messages by a mechanical device or communication partner. The messages are offered sequentially until the AAC user indicates the messages he or she wants to communicate. Pause and think of the answer before the reveal. The answer is D. Flashcard 29. Speech-generating devices can be set to use a voice reflective of a user's age and gender. Which type of speech output uses recorded speech that is stored on an augmentative and alternative communication AAC device and allows individuals to produce messages using appropriate inflection and intonation? A. Dynamic speech B. Preference speech C. Synthesized speech D. Digitized speech. Pause and think of the answer before the reveal. The answer is D. Flashcard 30. Many individuals with developmental disabilities will require augmentative and alternative communication AAC devices to communicate. What kind of instruction will clinicians need to provide that includes the use of techniques such as shaping, fading, prompting, and expectant time delay? A. Explicit B. Implicit C. Tactile kinesthetic D. Prompt. Pause and think of the answer before the reveal. The answer is A. Flashcard 31. The goal of language acquisition through motor planning LAMP is to build the user's receptive language skills through direct instruction. B. Provide a mode of independent communication and the ability of spontaneous expression. C. Teach users how to elaborate language using their device. D. Mold the user's expressive language skills using models and prompts. Pause and think of the answer before the reveal. The answer is B. Flashcard 32. Which of the following is an accurate representation of Light's four communicative competencies? A. Linguistic competence, operational competence, social competence, strategic competence. B. Language competence, functional competence, sociolinguistic competence, statistical competence. C. Linguistic competence, sociolinguistic competence, statistical competence, derivational competence. D. Metabolic competence, augmentative and alternative communication AAC, competence, pragmatic competence, syntax competence. Pause and think of the answer before the reveal. The answer is A. Flashcard 33. Augmentative and alternative communication AAC has been shown to facilitate speech in all of the following except A. The contexts where the individual must communicate. B. An individual's IQ level. C. The skills and supports available to partners. D. Options for different symbols, systems, and access modes. Pause and think of the answer before the reveal. The answer is B. Flashcard 34. Mrs. W is a 72-year-old patient who has just had a stroke. She has been diagnosed with apraxia of speech, which is often associated with lesions in a subcortical structures. B. Wernicke's area. C. Broca's area. D. The occipital area. Pause and think of the answer before the reveal. The answer is C. Flashcard 35. Usnavi, a 58-year-old immigrant from Cuba, suffered a right hemisphere stroke. When his family came to visit him in the hospital, he became very emotional as he was unable to recognize their faces. He could not recognize his own face and cried when he looked at himself in the mirror. His visual processing skills and decision-making skills remained intact. The speech-language pathologist informed his wife Yesley that her husband had blank. She mentioned to Yesley that currently there were no therapies that have resulted in lasting real-world improvements for those with his condition. However, the speech-language pathologist informed Yesley that many patients with Usnavi's condition can learn piecemeal recognition techniques, which include secondary clues like hair color, voice, and other features that are familiar to the patient. A. Achromatopsia. B. Topographical disorientation. C. Prosopagnosia. D. Paresthesia. Pause and think of the answer before the reveal. The answer is C. Flashcard 36. A patient was admitted to a hospital and was diagnosed with right hemisphere damage. The attending physician mentioned to the residents that patients with right hemisphere damage tend to demonstrate as severe naming problems. B. Profound auditory comprehension problems. C. Severe oral expression problems. D. Impaired comprehension of implied meanings. Pause and think of the answer before the reveal. The answer is D. Flashcard 37. Which area of the brain connects Broca's area with Wernicke's area? A. Corpus callosum. B. Choroid plexus. C. Arcuate fasciculus. D. Corona radiata. Pause and think of the answer before the reveal. The answer is C. Flashcard 38. Peter has suffered a cerebrovascular accident (CVA). The neurologist reports lesions in pars opercularis and pars triangularis of the inferior frontal gyrus and Brodmann area 44 and 45 of the dominant left cerebral hemisphere. Based on this, you conclude that the damaged area is of the occipital lobe. B. The basal ganglia. C. Wernicke's area. D. Broca's area. Pause and think of the answer before the reveal. The answer is D. Flashcard 39. A 68-year-old man experienced a stroke and had problems with reading. However, other language-related skills like auditory comprehension, naming, writing, or oral repetition were not affected. This condition, referred to as pure word blindness or alexia without agraphia, is also called A. Phoneme alexia. B. Neglect alexia. C. Visual alexia. D. Pure alexia. Pause and think of the answer before the reveal. The answer is D. Flashcard 40. Which of the following results from injury to the structures responsible for reading and is demonstrated in individuals as a difficulty with perceiving and comprehending written language? A. Traumatic brain injury (TBIB). Alexia. C. Dysarthria. D. Apraxia. Pause and think of the answer before the reveal. The answer is B. Flashcard 41. Select the statement that is true of conduction aphasia. A. It is caused by widespread lesions in the entire parasylvian region. B. It is characterized by good syntax, prosody, and articulation. C. Its lesion sites are more definitive than for other types of aphasia. D. Speech associated with it is as fluent as it is in Wernicke's aphasia. Pause and think of the answer before the reveal. The answer is B. Flashcard 42. Anita, a 64-year-old teacher with high blood pressure, was admitted to a nursing home because she had a stroke. The patient chart indicated that when she was admitted to the emergency room, she had dizziness, a loss of balance, nausea, seizures, and a total loss of consciousness. She had also ruptured blood vessels that not only compressed the brain tissue but also caused damage to the surrounding areas of the brain. The nurse mentioned to the family that the stroke was caused by a hemorrhage, b. ischemia, c. a thrombosis, d. an embolism. Pause and think of the answer before the reveal. The answer is A. Flashcard 43. A 72-year-old client suffered a stroke and had issues with poor memory, short attention span, rambling speech, impulsive behavior, left neglect, understanding jokes, and logically sequencing tasks. Based on this information, the physician mentioned to the family that the patient probably suffered A. cranial nerve X damage, B. damage to the hippocampus, C. left hemisphere brain damage, D. right hemisphere brain damage. Pause and think of the answer before the reveal. The answer is D. Flashcard 44. Damage to the blank gyrus often results in Gerstmann syndrome, which may result in alexia, agnosia, acalculia, left-right confusion, and agraphia. A cingulate, B. fornicate, C. angular, D. lingual. Pause and think of the answer before the reveal. The answer is C. Flashcard 45. Preston, a 58-year-old mechanic, was diagnosed with aphasia. To improve brain reorganization, the clinician was recommending therapy based on a theory that includes auditory processing for all aspects of language ability. Therapy would feature varying the load while providing intensive auditory stimulation to target word retrieval, word repetition, sentence formulation, writing, and reading. Which theory is this? A. Schuell's 1964 stimulation approach, B. Localization, Boston School, C. Neurolinguistics, D. Cognitive neuropsychological. Pause and think of the answer before the reveal. The answer is A. Flashcard 46. A speech-language pathologist is working with Norman, a 68-year-old patient who had a stroke. He is in the final stages of therapy and is progressing well. The speech-language pathologist mentions to the family that the goal is to work on the principle of transference plasticity with regard to experience-dependent plasticity. This means which of the following? A. The training experience must be adequately noticeable to induce plasticity. B. Failure to drive precise brain functions can result in functional degradation. C. Plasticity as a result of one training experience can improve the acquisition of comparable behaviors. D. Plasticity as a result of one experience can impede the acquisition of other behaviors. Pause and think of the answer before the reveal. The answer is C. Flashcard 47. A person with aphasia may have social communication limitations that include all of the following except A. Articulatory impairments, B. Conversational turn-taking difficulties, C. Difficulty holding a conversation via phone call, D. Conversational topic maintenance difficulties. Pause and think of the answer before the reveal. The answer is A. Flashcard 48. Which of the following statements is false? A. Wernicke's area in the temporal lobe is critical to comprehending spoken language. B. Wernicke's area is connected to Broca's area in the frontal lobe through the arcuate fasciculus. C. The occipital lobe contains the primary visual cortex. D. The angular gyrus in the occipital lobe is important for interpreting synesthetic sensations such as pain, touch, and temperature. Pause and think of the answer before the reveal. The answer is D. Flashcard 49. Which of the following is a quick screening test for aphasia that can be administered verbally and completed in about 5 to 15 minutes? A. Duration Aphasia Screening Test. B. SAGE Test. C. Mississauga Cognitive Screening Test. D. Mississippi Aphasia Screening Test. Pause and think of the answer before the reveal. The answer is D. Flashcard 50. You are assessing a 76-year-old woman for a possible diagnosis of aphasia. You are interested finding out the specific type of aphasia that the woman is experiencing. You notice that she has strong repetition skills but has trouble answering questions spontaneously. Her language comprehension is relatively intact, but her speech lacks intonation and rhythm. You notice that she has difficulties with lip and facial movements such as winking, whistling, and coughing on command. This condition alone might suggest which of the following? A. Wernicke's aphasia. B. Anomic aphasia. C. Ocular motor apraxia. D. Buccofacial apraxia. Pause and think of the answer before the reveal. The answer is D. Flashcard 51. Dr. G is a retired college dean who has had a stroke and displays right hemisphere syndrome. In your assessment of him, you can expect to find A. Language disorders, B. Speech disorders, C. Attention and perceptual deficits, D. Slow and sluggish responses. Pause and think of the answer before the reveal. The answer is C. Flashcard 52. The principle of specificity with regard to experience-dependent plasticity means which of the following? A. The training experience must be adequately noticeable to induce plasticity. B. Failure to drive precise brain functions can result in functional degradation. C. Plasticity as a result of one experience can impede the acquisition of other behaviors. D. The type of training experience determines the nature of the plasticity. Pause and think of the answer before the reveal. The answer is D. Flashcard 53. A blank develops when a blood clot occurs in a blood vessel and blood flow through the vessel reduces. A hematoma. B. Pulmonary embolism. C. Hemorrhage. D. Thrombosis. Pause and think of the answer before the reveal. The answer is D. Flashcard 54. You are assessing a 7-year-old child for a possible diagnosis of seizure disorder coupled with perinatal hypoxia. You are interested finding out the specific type of condition that the child is experiencing. You notice that she has an inability to voluntarily control purposeful eye movements in a desired direction. However, vertical eye movements are unaffected. This condition alone might suggest that the child has A. Wernicke's aphasia. B. Anomic aphasia. C. Ocular motor apraxia. D. Buccofacial apraxia. Pause and think of the answer before the reveal. The answer is C. Flashcard 55. What is true about Broca's aphasia? A. Speech is generally meaningless. B. Grammar is typically intact. C. It is never associated with apraxia of speech or dysarthria. D. It is often, though not always, caused by damage to the posterior inferior frontal gyrus in the left hemisphere. Pause and think of the answer before the reveal. The answer is D. Flashcard 56. You are working in a hospital when you are informed that a patient with Broca's aphasia has just been transferred to your caseload from another city. You can expect that this patient will show a non-fluent, effortful, agrammatic, and slow speech. B. Fluent, grammatically correct speech with plenty of jargon. C. Typically significant impairment in auditory comprehension. D. Intact confrontational naming. Pause and think of the answer before the reveal. The answer is A. Flashcard 57. Effie is a 61-year-old right-handed patient who had a right hemisphere stroke that resulted in aphasia. This is known as blank aphasia and is considered an exceptional aphasia as the damage has occurred in Effie's dominant hemisphere. A global B-crossed C conduction D associative. Pause and think of the answer before the reveal. The answer is B. Flashcard 58. Various arteries help supply blood to the face and the brain. Neurogenic communication disorders are associated with interrupted blood supply to the brain. Of the following statements about the arteries that supply blood to the brain, which one is correct? A. The internal carotid artery supplies the muscles of the face. B. Damage to the external carotid artery causes aphasia. C. Broca's area and Wernicke's area are supplied by the middle cerebral artery. D. If an artery below the circle of Willis is blocked, brain damage is maximal. Pause and think of the answer before the reveal. The answer is C. Flashcard 59. A semivowel that can be categorized as a voiced bilabial glide that is plus anterior and plus continuant is the A / W / B / J / C / L / D / H /. Pause and think of the answer before the reveal. The answer is A. Flashcard 60. You are working in an early intervention program in a local public school district. A highly unintelligible 4-year-old is referred to you by her preschool teacher, who says no one understands Ariella. It's all gibberish. I'm concerned because other children are starting to make fun of her. Ariella's parents are worried too. When you begin to assess Ariella and create a phonetic inventory for her, you will remember that A. Ariella should have mastered liquids /R/ and /L/B. Ariella should have mastered affricates C. Most stop sounds should be mastered by now D. Consonant clusters should be produced accurately. Pause and think of the answer before the reveal. The answer is C. Flashcard 61. In assessing children with language impairment/developmental language disorder, clinicians often count the number of morphemes in a child's utterance. This counting helps assess the length of single utterances that the child typically produces. Clinicians follow certain rules in counting morphemes. Of the following rules, which one is correct? A. Inflected words, such as looked, are counted as one morpheme. B. When words are repeated for emphasis, e.g., no, 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 each repetition is counted as a morpheme, i.e. 3 morphemes in the example. C. A compound word, such as birthday, is counted as one morpheme. D. Irregular past tense forms went, drank, bought are counted as 2 morphemes. Pause and think of the answer before the reveal. The answer is C. Flashcard 62. You are working with a 9-year-old girl who has been diagnosed with high-functioning autism spectrum disorder. She has an excellent vocabulary, as well as good morphological and syntactic skills. However, her pragmatic skills are reportedly delayed, and her parents wish for her to gain better social skills. Which one of the following would not be an appropriate treatment goal for her? A. Initiate and maintain conversation in small groups. B. Sustain a topic through a number of conversational turns. C. Announce topic shifts. D. Make sure conversations with peers focus on her interests and hobbies so that she can maintain control of the topic. Pause and think of the answer before the reveal. The answer is D. Flashcard 63. When treating a student with a language disorder, it is important to incorporate all of these principles except what? A. Target language behaviors that create social penalties for children. B. Focus on academic and social language. C. Select literacy skills when appropriate. D. Ignore any inappropriate behavior, for example, interrupting. Pause and think of the answer before the reveal. The answer is D. Flashcard 64. When determining a child's mean length of utterance, the following should be considered: two morphemes: A. Regular verbs plus ing. B. Auxiliary verbs. C. Proper names. D. Irregular plurals, for example, mice, feet, geese. Pause and think of the answer before the reveal. The answer is A. Flashcard 65. What are the most commonly described suprasegmentals or prosodic features that affect speech production? A. Labials, bilabials, linguodentals, and glottals. B. Nasals, stops, fricatives, liquids, and glides. C. Consonants, vowels, voiced sounds, and voiceless sounds. D. Length of vowels, stress, rate, pitch, volume, and juncture. Pause and think of the answer before the reveal. The answer is D. Flashcard 66. The phoneme that can be characterized as a voiced linguopalatal glide that is plus continuant plus high is A slash W slash B slash V slash C slash C slash D slash J slash. Pause and think of the answer before the reveal. The answer is D. Flashcard 67. A child has been referred to you for an assessment of his pragmatic skills. The chief complaint of adults and children with whom he interacts is that he frequently gives commands and sounds rude and bossy. His classroom teacher says she is fed up with his bossiness, and peers do not include him in their games. His father tells you that the boy frequently says things like "take me to Chuck E. Cheese" or "get me a new app for my phone." The father would like intervention to help his son say things like, "I wonder if we could get a new app for my phone at the store," instead of giving orders. In therapy, you will need to work on the boy's facility with a didactic monologues. B. Narrative skills. C. Indirect requests. D. Cohesion. Pause and think of the answer before the reveal. The answer is C. Flashcard 68. Melissa says clink instead of blink. She produces an incorrect sound in place of a correct sound. This articulation error is known as a omission. B. Substitution. C. Accommodation. D. Adaptation. Pause and think of the answer before the reveal. The answer is B. Flashcard 69. You have just administered a standardized test of articulation to a boy with a speech sound disorder. You had decided that the test was appropriate for the child because children of the same background as the child were sampled in the normative standardization process. The child scored in the 50th percentile on the test. Which of the following statements is a correct interpretation of this score? A. The child is below average in speech sound production. B. The child's score is equivalent to the median in the normative sample. C. The child is above average in speech sound production. D. The test results suggest target speech productions for treatment. Pause and think of the answer before the reveal. The answer is B. Flashcard 70. Which of the following is not a general language deficit of children with autism spectrum disorder? A. Inadequate response to speech. B. Perseveration on certain words or phrases. C. Slow acquisition of speech sound production and language. D. Delayed morphosyntactic skills. Pause and think of the answer before the reveal. The answer is D. Flashcard 71. You have been asked to evaluate the language skills of a 6-year-old child who is having difficulty in her first grade classroom. When you are evaluating her, you notice that she says things like her no eat candies. This utterance is an example of a 4 words, 6 morphemes, modal plus adjective plus auxiliary B 4 words, 4 morphemes, negative plus noun plus verb C 4 words, 5 morphemes, personal pronoun plus negative plus verb plus plural noun D 4 words, 6 morphemes, personal pronoun plus adjective plus noun. Pause and think of the answer before the reveal. The answer is C. Flashcard 72. The theory that asserts that each child is born with an innate language acquisition device (LAD) is the anativist theory of Chomsky. B. Cognitive theory of Piaget. C. Behavioral theory of Skinner. D. Social interactionist theory of Vygotsky. Pause and think of the answer before the reveal. The answer is A. Flashcard 73. You are working with a 2-year-old boy to offer early intervention. His parents are concerned because they want him to go to preschool next year, but they believe his language skills will be insufficient for him to be successful in interacting in a preschool environment. The boy's language skills are comparable to those of a 50-month-old. He says only around 10 words. An appropriate therapy goal for this child might include a use of 2-word combinations. B. Development of basic morphological features. C. Comprehension of compound sentences. D. Use of functional words in 1-word utterances. Pause and think of the answer before the reveal. The answer is D. Flashcard 74. In a therapy session with a clinician and 3-year-old child with a language impairment/developmental language disorder, the child says more juice. The clinician replies with "You want more of that tasty grape juice poured in your cup." The clinician has just used the technique of man model B, focused stimulation C, extension D, parallel talk. Pause and think of the answer before the reveal. The answer is C. Flashcard 75. An 8-year-old girl, Tina, is referred to you because she reportedly has difficulty with the lingualveolar voiceless fricative. You can predict that in therapy you will address which sound? A /D/B /T/C /S/D/C/. Pause and think of the answer before the reveal. The answer is C. Flashcard 76. You are treating a 4-year-old boy with specific language impairment/developmental language disorder for intervention. You notice that he omits all grammatical morphemes in his speech. Which one of the following morphemes would you target first in therapy with him? A. Articles A and the B. Regular plural SC. Present progressive ing D. Regular past tense ed. Pause and think of the answer before the reveal. The answer is C. Flashcard 77. A child from Culver City transfers to Central City, and his file indicates that he has been receiving speech-language services in Culver City. Some pages of the report from the speech-language pathologist in Culver City are missing. However, the first page indicates that this child has Mobius syndrome. He also has a history of frequent hospitalizations. What can the Central City clinician probably expect to find? A. This child has syndactyly cranial synostosis, resulting in smaller anterior posterior skull diameter, high forehead, an arched and grooved hard palate, class Roman 3 malocclusion, and possible cleft of the hard palate. B. This child has delayed language and an articulation disorder, as well as bilabial paresis and weak tongue control for lateralization, elevation, depression, and protrusion, a mask-like face, a history of feeding problems in infancy, and unilateral or bilateral paralysis of the abductors of. Pause and think of the answer before the reveal. The answer is B. Flashcard 78. The phoneme /k/ sounds the same perceptually to the listener, however, it is produced in a slightly different manner in the words kitten, bucket, and cook. These variations of the /k/ phoneme are called aphonemes. B. Allophones. C. Morphemes. D. Diphthongs. Pause and think of the answer before the reveal. The answer is B. Flashcard 79. You begin working with a highly unintelligible child. You decide to use the cycles approach to intervention. Which one of the following is false about the cycles approach to intervention with unintelligible children? A. Children must produce phonological patterns at least 40% of the time or more in order for these patterns to become treatment targets. B. Error patterns should not be drilled to a criterion of mastery, for example 90% accuracy. Rather, the clinician introduces correct patterns, gives the child limited practice with them, and returns to them at a later date. C. A cycle runs 5-16 weeks, and each child usually requires 3-6 cycles to become intelligible. D. In each therapy session, 3-4 patterns are targeted. Pause and think of the answer before the reveal. The answer is D. Flashcard 80. According to Brown's stages, what is the last morpheme to be acquired by a typically developing child? A. Prepositions. B. Regular third person SC. Uncontractable auxiliary. D. Contractable auxiliary. Pause and think of the answer before the reveal. The answer is D. Flashcard 81. To assess a child's pragmatic skills, a clinician may observe which of the following behaviors, among others? A. Turn-taking and discourse skills. B. Production of past tense inflections. C. Production of is plus verb ing structures. D. Production of prepositions. Pause and think of the answer before the reveal. The answer is A. Flashcard 82. The term blank refers to the abstract system of sounds, whereas the term blank refers to concrete productions of specific sounds. A phonetic, phonemic. B. Phonemic, phonetic. C. Allophonic, phonetic. D. Phonemic, allophonic. Pause and think of the answer before the reveal. The answer is B. Flashcard 83. A speech-language pathologist is obtaining a language sample because she believes that the child she is treating may have a language impairment/developmental language disorder. The speech-language pathologist may want to avoid a noisy room with a lot of stimulation. B. Using toys, books, and games to elicit conversation. C. Allowing peers or family members to interact with the child. D. Recording the sample for later analysis because this is distracting to the child. Pause and think of the answer before the reveal. The answer is A. Flashcard 84. Hearing loss that occurs when the middle ear and the inner ear are not functioning properly is known as a sensorineural hearing loss. B. Middle ear hearing loss. C. Mixed hearing loss. D. Conductive hearing loss. Pause and think of the answer before the reveal. The answer is C. Flashcard 85. Sensitivity to sound of the normal ear of a young adult is limited to a 30 Hz to 30,000 Hz. B. 5 Hz to 5,000 Hz. C. 7 Hz to 70,000 Hz. D. 20 Hz to 20,000 Hz. Pause and think of the answer before the reveal. The answer is D. Flashcard 86. Vijay, a 70-year-old man, attends a clinic for a hearing evaluation. After conducting testing, the audiologist mentions that a common cause of conductive hearing loss, where there is a buildup of spongifying bone on the osseous labyrinth that immobilizes the footplate of the stapes and interferes with sound transmission to the inner ear, is A. Meniere's disease. B. Otosclerosis. C. Otitis media D. Acoustic neuroma. Pause and think of the answer before the reveal. The answer is B. Flashcard 87. Molly, a 26-year-old woman, just gave birth to a healthy baby girl. The doctors want to test the hearing of her newborn. Which of the following techniques is used to record the electrical activity in the auditory nerve, brainstem, and the cortical areas of the brain in newborn hearing screenings? A. Electrocochleography. B. Auditory brainstem response. C. Axial tomography. D. Magnetic resonance imaging. Pause and think of the answer before the reveal. The answer is B. Flashcard 88. An audiologist is testing a client in a soundproof booth. She asks her client to put on headphones that deliver the sound stimulus directly to the ear. The audiologist tells the client that if she hears a sound, she should respond by holding up her hand or pressing a switch that lights up on the audiometer. What test is being conducted? A. Air conduction. B. Auditory brainstem response. C. Tympanometry. D. Speech recognition. Pause and think of the answer before the reveal. The answer is A. Flashcard 89. Patients who have damage to their nerve fibers along the ascending auditory pathways from the internal auditory meatus to the cortex have a cochlear disorder. B. Retrocochlear disorder. C. Recruitment disorder. D. Middle ear disorder. Pause and think of the answer before the reveal. The answer is B. Flashcard 90. A spongy growth that starts on the footplate of the stapes and causes it to become rigid is known as ototoxicity. B. Ossicular discontinuity. C. Otosclerosis. D. Chronic otitis media. Pause and think of the answer before the reveal. The answer is C. Flashcard 91. Grayson, a 5-year-old patient, came to an audiologist for a hearing evaluation. His parents were unsure whether he has a hearing loss. His parents mentioned that he often seems confused when people are talking to him. At the kindergarten Grayson attends, the class is split up into 2 groups. The teacher does story time for one group, and the assistant teacher does arts and crafts with the second group. During story time, it can be a little noisy in the classroom. The teacher often asks simple reading comprehension questions after the story has been read. Whenever the teacher calls on Grayson to answer a question, he usually answers with an unrelated response. Grayson's parents are confused with this because at home, he seems to comprehend things well. This made them think that Grayson has a hearing loss because he seems to have trouble hearing in a busy classroom environment where a lot is going on. In general, Grays. Pause and think of the answer before the reveal. The answer is A. Flashcard 92. You are trying to differentiate whether your patient's sensorineural hearing loss was caused by a lesion in the inner ear or in the auditory nerve. You place a headphone on one ear and insert the probe assembly into the contralateral ear. If you are trying to find the lowest possible intensity needed to elicit a middle ear muscle contraction, which of the following thresholds would that be? A. Speech reception threshold. B. Bone conduction threshold. C. Acoustic reflex threshold. D. Air conduction threshold. Pause and think of the answer before the reveal. The answer is C. Flashcard 93. The most severe form of pinna deformity is microtia, where the pinna is small and underdeveloped. This is typically associated with what condition? A. Stenosis. B. Atresia. C. External otitis. D. Otosclerosis. Pause and think of the answer before the reveal. The answer is B. Flashcard 94. Mina is a 6-year-old with a profound hearing loss. She is a friendly, outgoing girl who enjoys socializing with others. Mina is doing well in school. However, Mina's classroom teacher refers her to you for a speech evaluation. He tells you that sometimes the other students and I have a hard time understanding what Mina is saying. In terms of Mina's speech, which one of the characteristics below would you not expect her to exhibit? A. Difficulty with most consonants, but highly accurate production of vowels. B. Consonant cluster reduction. C. Distortions of sounds, especially stops and fricatives. D. Epenthesis or adding a schwa to a consonant blend. Pause and think of the answer before the reveal. The answer is A. Flashcard 95. A mother brings her 4-year-old daughter, Megan, for a hearing screening. She shares that Megan has had many middle ear infections, which have been treated with antibiotics. These middle ear infections started when Megan was 2 years old. The mother has been told by a friend that middle ear tubes might be a good option for Megan, but the mother states that she is afraid of the surgery that this would entail. After all, Megan is only 4 years old and her mother does not want her to be traumatized. The mother tells you, even though Megan ignores me sometimes, I think everything will be okay. I just wanted her to get checked out to be sure. The audiologist assesses Megan, with the resulting audiogram shown below. What type of problem does Megan have, based on this audiogram? A. Mixed loss. B. Otitis media with effusion. C. Sensorineural loss. D. Noise-induced loss. Pause and think of the answer before the reveal. The answer is B. Flashcard 96. A patient exhibits a reduction in hearing sensitivity when tested by air conduction, however, he shows normal sensitivity by bone conduction. This condition is called A. Otitis media. B. Sensorineural hearing loss. C. Conductive hearing loss. D. Mixed hearing loss. Pause and think of the answer before the reveal. The answer is C. Flashcard 97. Speech reception thresholds SRTS are determined by the patient's response to a list of monosyllabic words presented at a low level of hearing. Be determined by looking at the patient's pure tone test results at the frequencies most important to speech. C. The lowest levels of hearing at which a person can understand 100% of the words presented. D. The lowest levels of hearing at which a person can understand 50% of the words presented. Pause and think of the answer before the reveal. The answer is D. Flashcard 98. The softest level of hearing at which a person can understand 50% of the words presented is known as a pure tone threshold. B. Speech discrimination threshold. C. Speech reception threshold. D. Word discrimination threshold. Pause and think of the answer before the reveal. The answer is C. Flashcard 99. Maris's mother takes her to the emergency room because she notices a foul-smelling discharge coming from Maris's ear. The doctor examines Maris's ear and sees that her tympanic membrane is permanently ruptured. The doctor explains to Maris's mother that she will need to repair the tympanic membrane by using which of the following surgical procedures? A. Myringoplasty. B. Myringotomy. C. Middle ear fusion. D. Staptectomy. Pause and think of the answer before the reveal. The answer is A. Flashcard 100. What are the two most prominent air-filled cavities that compose the outer ear and have a resonant frequency to which they respond best? A. Concha. B. Tympanic cavity. C. Ear canal. D. Ossicles. E. Helix. F. Antihelix. Pause and think of the answer before the reveal. The answer is A and C. Flashcard 101. An audiologist is conducting a hearing test on an 84-year-old patient he suspects has a hearing loss. He would like to evaluate baseline hearing of the patient and provides her with a list of two-syllable or dissyllable words that are pronounced with equal stress on the first and second syllables, for example, suitcase, pushcart. Which test is the audiologist administering? A. Spondy recognition test. B. Whispered recognition test. C. Rin test. D. Weber test. Pause and think of the answer before the reveal. The answer is A. Flashcard 102. The two muscles in the middle ear that dampen the vibrations of the tympanic membrane and the ossicular chain are the levator tympani and stapes muscle. B. Auditory meatus and levator tympani. C. Tensor tympani and stapes muscle. D. Buccinator tympani and risorius. Pause and think of the answer before the reveal. The answer is C. Flashcard 103. An audiologist is conducting a hearing test and sends an acoustic signal through a headphone at a level that is strong enough to obscure the tone heard in the opposite ear. Which of the following statements is not true about masking? A. Masking allows the clinician to eliminate the non-test ear from participation while measuring hearing thresholds for the test ear. B. The masking noise in the non-test ear must be enough to make any sound crossing the skull from the test ear inaudible. C. For testing hearing by bone conduction, masking is needed whenever the difference between the air bone gap is 60 dB or more. D. The plateau method is a procedure used to determine how much masking is sufficient. Pause and think of the answer before the reveal. The answer is C. Flashcard 104. Which term describes an abnormal increase in the perceived loudness of sound when it is presented with linear increases in intensity? A. Recruitment. B. Air conduction. C. Rarefaction. D. Displacement. Pause and think of the answer before the reveal. The answer is A. Flashcard 105. A father tells you that he is concerned about his son Adam, who has had many episodes of otitis media with effusion. Adam has taken antibiotics for the last 7 months, but testing reveals that he continues to have middle ear fluid, although he is not sick. You refer Adam and his father to a pediatrician who asks an ear, nose, and throat doctor to perform a surgical procedure in which a small incision will be made in Adam's tympanic membranes to relieve pressure. This procedure is known as a pressure equalizing tubes. B. Myringoplasty. C. Otosclerosis. D. Myringotomy. Pause and think of the answer before the reveal. The answer is D. Flashcard 106. Sally just delivered her first baby boy. The pediatrician has noticed that the child was born with his external ear canal completely closed. The doctor explains that the child has external otitis. B. Otitis media. C. Myringotomy. D. Oral atresia. Pause and think of the answer before the reveal. The answer is D. Flashcard 107. A 54-year-old man came to an ENT physician complaining of vertigo, fluctuating hearing loss, tinnitus, and a fullness of pressure in the ear. The patient informed the doctor that the episodes of vertigo last for about 30 minutes at a time. After conducting several tests, including videonystagmography, rotary chair testing, vestibular evoked myogenic potential testing, and posturography, the doctor diagnosed an autoimmune inner ear disease. B. Presbycusis. C. An acoustic neuroma. D. Meniere's disease. Pause and think of the answer before the reveal. The answer is D. Flashcard 108. An audiologist is testing Fuang, a 45-year-old woman who says she is having difficulty hearing on the phone. Fuang states that when she is in noisy settings like parties, It is harder for her to hear than it used to be. Among other things, the audiologist assesses Fuang's blank, which is the lowest intensity of a sound necessary to stimulate the auditory system. A. Hearing level B. Sound pressure level C. Auditory threshold D. Speech reception threshold. Pause and think of the answer before the reveal. The answer is A. Flashcard 109. When is there a need for speech therapy when tumors and surgical procedures are involved? A. There is never a need for speech therapy with someone who has a tumor. B. Speech therapy is always needed for someone who has a tumor. C. Speech therapy should be involved when the tumor or surgery compromises vocal or speech function. D. There is a need for speech therapy when the tumor does not resolve on its own. Pause and think of the answer before the reveal. The answer is C. Flashcard 110. When assessing a client diagnosed with head and neck cancer, which of the following is a focus of pre-treatment assessment? A. Conducting a dynamic assessment including trials of compensatory communication systems. B. Providing education and counseling for anticipated changes in communication and swallowing, as well as possible future therapy needs. C. Conducting training trials in the care and use of tracheoesophageal voice prosthesis prior to placement. D. Obtaining a detailed description of the client's current needs based on the surgical resection or chemoradiology treatment. Pause and think of the answer before the reveal. The answer is B. Flashcard 111. Some total laryngectomy patients present with a fold of tissue at the base of the tongue, which can have an impact on swallowing following surgical intervention. The fold of tissue is either mucous membrane or scar tissue that originates from the lateral pharyngeal wall and travels into the base of the tongue. This condition is called A. Prosthesis. B. Pseudoepiglottis. C. Ariepiglottic fold. D. False vocal fold. Pause and think of the answer before the reveal. The answer is B. Flashcard 112. A speech-language pathologist is explaining stages of laryngeal cancer to a patient. The speech-language pathologist mentions that the medical chart indicates that the patient is carcinoma in situ. This stage of carcinoma is A. Stage 0B, Stage IC, Stage Roman 2D, Stage Roman 3. Pause and think of the answer before the reveal. The answer is A. Flashcard 113. When working with individuals with lung cancer, the speech-language pathologist must be completely familiar with the anatomy and physiology of all of the following except A. The normal laryngeal mechanism. B. The respiratory system. C. The supraglottic structures. D. The gastrointestinal tract. Pause and think of the answer before the reveal. The answer is D. Flashcard 114. If the hyoid bone is partially or completely removed secondary to cancer, which of the following would be damaged? A. Laryngeal suspension and elevation. B. False vocal fold constriction. C. Thyroid tilt. D. Epiglottic inversion. Pause and think of the answer before the reveal. The answer is A. Flashcard 115. Tumors in the larynx are staged following the tumor node metastases TNM system. In this process, larynx is divided into 3 areas that include all of the following except A. The glottis. B. The subglottis. C. The superior glottis. D. The supraglottis. Pause and think of the answer before the reveal. The answer is C. Flashcard 116. Speech-language pathologists are responsible for educating themselves about the specifics of a partial laryngeal incision. This includes all of the following except A. The structures that remain intact. B. The anatomy that changes. C. What functional skills remain relative to the individual's ability to phonate. D. The length of the surgical procedure. Pause and think of the answer before the reveal. The answer is D. Flashcard 117. Laryngeal cancers that form on the vocal folds are often detected early because of the mass interrupts the vibration of the vocal folds, causing hoarseness. B. Of chronic and excessive coughing. C. Of severe dysphagia. D. The mass on the vocal folds results in ability to inhale and exhale. Pause and think of the answer before the reveal. The answer is A. Flashcard 118. Which of the following procedures involves a placement of a small flexible prosthesis into a surgically placed puncture in the patient's stoma? A. Tracheoesophageal puncture. B. Laryngeal puncture. C. Electrolarynx procedure. D. Staphyloneoglottis procedure. Pause and think of the answer before the reveal. The answer is A. Flashcard 119. You have been asked to counsel with John, a 70-year-old man who has smoked and drank alcohol since he was a teenager. He now has laryngeal cancer, and before surgery, the surgeon asks you to talk with John about esophageal speech. You explain to John that there are two basic types of esophageal speech. In one method, the patient is taught to keep the esophagus open and relaxed while inhaling rapidly. In the other method, the patient impounds the air in the oral cavity, pushes it back into the esophagus, and vibrates the cricopharyngeus muscle. What is the second method called? A. Inhalation method. B. Laryngeal airway resistance method. C. Inhalatory injection method. D. Injection method. Pause and think of the answer before the reveal. The answer is D. Flashcard 120. When is a speech-language pathologist responsible for counseling a laryngeal cancer patient in terms of their speech and swallowing treatment? A. A speech-language pathologist is not responsible for counseling with regard to speech and swallowing treatment. B. A speech-language pathologist should only counsel a patient about speech and swallowing issues if requested by the patient. C. A speech-language pathologist should counsel a patient about speech and swallowing prior to treatment. D. A speech-language pathologist should only counsel a patient about speech and swallowing after treatment. Pause and think of the answer before the reveal. The answer is C. Flashcard 121. A patient was receiving irradiation to the oral and pharyngeal areas and was experiencing xerostomia, as well as weight loss and an increase in dental caries. During the evaluation, the clinician recommended that the patient swallow once prior to taking a spoonful of food in the mouth. B. Swallow twice prior to taking a spoonful of food in the mouth. C. Be given synthetic saliva just prior to eating. D. Use a chin tuck procedure before swallowing. Pause and think of the answer before the reveal. The answer is C. Flashcard 122. Cancer can be spread in the body by all of the following ways except A. Tissue. B. Lymph system. C. Blood. D. Saliva. Pause and think of the answer before the reveal. The answer is D. Flashcard 123. Debbie, a 42-year-old, was diagnosed with laryngeal cancer and has been noticing changes in her voice. Which of the following is the primary voice symptom of laryngeal cancer? A. Diplophonic. B. Breathiness. C. Hoarseness. D. Strain. Pause and think of the answer before the reveal. The answer is C. Flashcard 124. When a patient has undergone a total laryngectomy, the gastrointestinal tract is physically separated from the A. Spinothalamic tract B. Spinocerebellar tract C. Extrapyramidal tract D. Respiratory tract. Pause and think of the answer before the reveal. The answer is D. Flashcard 125. What type of partial laryngectomy procedure is used when there is a smaller lesion on the supraglottic larynx? A. Vertical or subglottic laryngectomy. B. Horizontal or supraglottic laryngectomy. C. Lateral or supraglottic laryngectomy. D. Medial or glottic laryngectomy. Pause and think of the answer before the reveal. The answer is B. Flashcard 126. A patient with end-stage cancer was experiencing loss of weight, fatigue, weakness, and a significant reduction in appetite. The oncologist mentioned to the speech-language pathologist that even though the patient was not actively trying to lose weight, his loss of body mass would be difficult to reverse nutritionally because he had aggressive cancer. This condition of weight loss that is a common complication associated with cancer is called a gluconeogenesis. B. Cachexia. C. Anorexia. D. Lipolysis. Pause and think of the answer before the reveal. The answer is B. Flashcard 127. Depending on the location and size of the cancerous lesion, the tumor may affect which of the following? A. Vocal fold abduction. B. Vocal fold closure. C. Thyroid tilt. D. Epiglottic inversion. Pause and think of the answer before the reveal. The answer is B. Flashcard 128. Tumors in the larynx may be treated by all of the following except A. Acupuncture. B. Chemotherapy. C. Radiation therapy. D. Surgery. Pause and think of the answer before the reveal. The answer is A. Flashcard 129. One criterion for a patient to receive a supraglottic laryngectomy is that they must have the potential to A. Use an electrolarynx. B. Relearn a swallowing sequence. C. Occlude a stoma to be able to speak. D. Swallow without aspiration immediately following surgery. Pause and think of the answer before the reveal. The answer is B. Flashcard 130. The spread of cancer from a primary tumor to a new site is referred to as A. Traveling. B. Metastases. C. Metathesis. D. Mitosis. Pause and think of the answer before the reveal. The answer is B. Flashcard 131. During which procedure can a physician remove small samples of tissue to study under a microscope to determine if the cells or tissues are cancerous? A. PET scan. B. Biopsy. C. CT scan. D. MRI. Pause and think of the answer before the reveal. The answer is B. Flashcard 132. A 55-year-old man comes to you stating that he has been sounding hoarse for the last few months. He also states that he has difficulty swallowing, ear pain, and a lump in his neck. He shares with you that he has an ongoing sore throat. You suspect that his diagnosis will probably be A. Laryngeal web. B. Laryngeal cancer. C. Vocal nodules. D. Granuloma. Pause and think of the answer before the reveal. The answer is B. Flashcard 133. A speech-language pathologist in a hospital was explaining to Jorge, a 55-year-old cancer survivor, that if physicians control aspiration by reconstructing a narrow gap between the vocal folds, the airway becomes compromised and the only way to eliminate the potential of aspiration is A. A permanent tracheostomy. B. temporary vocal fold augmentation C. A temporary tracheostomy D. Electrolarynx. Pause and think of the answer before the reveal. The answer is A. Flashcard 134. The cerebral palsies originate in infancy, and the speech impairment that may coexist with the movement disorder is also considered blank. A. Verbal apraxia B. Dysarthria C. Dysphagia D. Neuromuscular difficulties. Pause and think of the answer before the reveal. The answer is B. Flashcard 135. A child with cerebral palsy has higher auditory detection thresholds, poorer speech reception thresholds, and poor speech discrimination than a typically developing child. You would recommend an audiological examination, B. Stretch reflex testing, C. A complete swallowing evaluation, D. A visual acuity assessment. Pause and think of the answer before the reveal. The answer is A. Flashcard 136. The most common symptom of cerebral palsy is A. Ataxic dysarthria B. Bradykinesia C. Spasticity D. Hemibolism. Pause and think of the answer before the reveal. The answer is C. Flashcard 137. Darren, a client with cerebral palsy who was just added to your caseload, presents with uncontrollable movements that are rapid and jerky. You observe that Darren is experiencing trouble controlling movement in his hands, arms, feet, and legs. It appears that his tone changes throughout the day. What type of cerebral palsy does Darren have? A. Spastic B. Ataxic C. Dyskinetic D. Mixed. Pause and think of the answer before the reveal. The answer is C. Flashcard 138. As a speech-language pathologist, why is it important to involve parents of a child with cerebral palsy? A. To understand and monitor the effects of the medication the child is taking. B. To teach parents how to help their child meet his or her physical demands. C. To make medical recommendations. D. To counsel about the effects of cerebral palsy on communication and their role in stimulating language at home. Pause and think of the answer before the reveal. The answer is D. Flashcard 139. Speech is a dynamic process requiring precisely coordinated articulatory movements for the sequencing of sounds to ultimately produce words. What is common among children with cerebral palsy? A. Apraxia B. Flaccidity C. Speech impairment D. Hyponasality. Pause and think of the answer before the reveal. The answer is C. Flashcard 140. As a speech-language pathologist, which of the following is not something you would treat if your client is diagnosed with cerebral palsy? A. Treatment of language disorders. B. Treatment of articulation and phonological disorders. C. Managing non-associated attentional problems. D. Managing associated sensory problems. Pause and think of the answer before the reveal. The answer is C. Flashcard 141. A child with cerebral palsy typically presents with a host of impairments that can include A. Dyskinesia B. Intellectual C. Sensory D. Orthopedic E. Myoclonus F. Socioemotional G. Communication. Pause and think of the answer before the reveal. The answer is BCFG. Flashcard 142. Various classification systems for cerebral palsy have been proposed. 6 common symptom areas include athetosis, cerebellar ataxia, rigidity, tremors, flaccidity, and blank. A. Spasticity B. Hypernasality C. Parkinsonism D. Tardive dyskinesia. Pause and think of the answer before the reveal. The answer is A. Flashcard 143. As a speech-language pathologist, how would you manage associated attentional problems for a client with cerebral palsy? A. Teaching breath cycle to pattern the patient's breathing. B. Using behavioral treatment to address the attention deficit that the child may exhibit during sessions. C. Incorporating longer, less frequent therapy sessions. D. Providing longer treatment activities to hold the patient's attention. Pause and think of the answer before the reveal. The answer is B. Flashcard 144. A student is reviewing information for a final exam. She discusses in her study group that a cause of cerebral palsy involves blank, a injury to the cerebral oxygen levels during the prenatal or perinatal period. B. Reduced glucose levels. C. Injury to the limbic system. D. Damage to the meninges. Pause and think of the answer before the reveal. The answer is A. Flashcard 145. Which of the following is not a likely cause of congenital cerebral palsy? A. Meningitis. B. Dementia. C. Traumatic brain injury. D. Stroke. Pause and think of the answer before the reveal. The answer is B. Flashcard 146. What is an important factor to consider when treating a voice disorder for a patient with cerebral palsy? A. Understanding the effects of how the voice disorder can improve limb movement. B. Recognizing how improvement of the voice disorder can increase mandibular range of motion. C. Considering the implications that the voice disorder may have on brain stimulation. D. Being aware that the voice disorder may be attributable to respiratory problems associated with cerebral palsy. Pause and think of the answer before the reveal. The answer is D. Flashcard 147. Which of the following is the most common form of mixed cerebral palsy? A. Dyskinetic athetoid. B. Ataxic dyskinetic. C. Spastic ataxic. D. Spastic dyskinetic. Pause and think of the answer before the reveal. The answer is D. Flashcard 148. Which of the following is important when treating language disorders for a child with cerebral palsy? A. Teaching the parents techniques learned from the team of specialists working with their child. B. Assessing the child's language and prescribing medications that are appropriate in improving speech. C. Using and modifying treatment procedures to suit the individual child with cerebral palsy. D. Considering the child's rate of speech and how it affects his or her visual coordination. Pause and think of the answer before the reveal. The answer is C. Flashcard 149. While conducting rounds at a local pediatric hospital, a physician sees several children with brain damage sustained before, during, or shortly after birth. She mentions to the speech-language pathology students who are shadowing her that this type of brain damage usually produces movement disorders known as A. Cerebral palsy. B. Apraxia. C. Diadochikinesis. D. Aphasia. Pause and think of the answer before the reveal. The answer is A. Flashcard 150. A clinical supervisor is quizzing her graduate student clinician during a break from seeing patients. At their rehabilitation center, they see many patients with cerebral palsy. She asks the student what the most appropriate characteristics would be if congenital or neurodevelopmental motor speech disorders are associated with cerebral palsy. What is the correct answer? A. Apraxia of speech. B. Aphasia. C. Dysphagia. D. Dysarthria. Pause and think of the answer before the reveal. The answer is D. Flashcard 151. Of the options below, which evaluation technique would be most appropriate for monitoring speech intelligibility over time for an individual with cerebral palsy? A. Percent consonant correct PCC. B. Rate of speech. C. Bloods analysis. D. Biorum speech informal assessment. Pause and think of the answer before the reveal. The answer is A. Flashcard 152. Treatment focused on improving oral motor control and increasing strength in the head, neck, and throat muscles would be targeting which of the following? A. Fluency disorders. B. Articulation disorders. C. Dysphagia. D. Voice disorders. Pause and think of the answer before the reveal. The answer is B. Flashcard 153. Treatment of communication disorders associated with cerebral palsy requires a thorough understanding of which of the following? A. The consequences of the neuromotor problems of the disorder and how the problems affect speech production. B. The patient's level of visual impairments. C. The score the patient received on the Rancho Los Amigos scale of cognitive levels revised. D. Understanding how to control normal reflexes. Pause and think of the answer before the reveal. The answer is A. Flashcard 154. A speech-language pathologist should consider which of the following to include as part of general principles regarding treatment of cerebral palsy? A. Cerebral palsy is a unique speech disorder and generalized treatment approaches that are used for other children can be applied to treat these children. B. Make a thorough assessment of communication problems and design treatments to suit the child's problems, needs, and strengths. C. Disregard educational demands made or to be made on the child. D. Prescribe pharmacological intervention. Pause and think of the answer before the reveal. The answer is B. Flashcard 155. When the muscles underlying speech are affected, we may notice that the person has a motor speech disorder subsequent to the cerebral palsy. Which motor speech disorder would the patient present with? A. Aphasia. B. Abnormal reflexes. C. Dysphagia. D. Dysarthria. Pause and think of the answer before the reveal. The answer is D. Flashcard 156. Tanya is a 4-year-old who presents with muscle stiffness in her legs. Her arms are not affected at all. Tanya struggles to walk because her tight hip and leg muscles cause her legs to pull together. What type of spastic cerebral palsy does Tanya have? A. Spastic hemiplegia. B. Spastic diplegia. C. Spastic quadriplegia. D. Spastic triplegia. Pause and think of the answer before the reveal. The answer is B. Flashcard 157. Natalie is 4-year-old with cerebral palsy and has been diagnosed with gastroesophageal reflux. She frequently throws up and cannot retain nourishment. The physician diagnoses Natalie with a weak or hypersensitive, a digastricus. B. Palatoglossus. C. Esophageal sphincter. D. Epiglottis. Pause and think of the answer before the reveal. The answer is C. Flashcard 158. A child with cerebral palsy is seen for an evaluation. During the assessment, Kara, the speech-language pathologist, notices that the child's jaw is impaired relative to other structures. Kara is trying to focus on improving the child's speech by increasing tongue movement to improve articulatory proficiency. Kara would use the following to determine whether the child would be a candidate for constraint-induced movement therapy. A. Modified barium swallow study. B. Bite block. C. Tongue depressor. D. Endoscopic evaluation. Pause and think of the answer before the reveal. The answer is B. Flashcard 159 blank memory consists of remembering facts and events, and refers to the memories that can be consciously recalled. Procedural short-term declarative implicit. Pause and think of the answer before the reveal. The answer is declarative. Flashcard 160. A clinician who works in a skilled nursing facility has an 82-year-old male patient referred to her. The patient presents with a mask-like face, tremors in his muscles that stop when he moves voluntarily, swallowing problems, imprecise articulation, and difficulty walking. This patient most likely has A. Alzheimer's disease, B. Apraxia of speech, C. Dysarthria, D. Parkinson's disease. Pause and think of the answer before the reveal. The answer is D. Flashcard 161. You are seeing a patient who presents with Parkinson's disease. The patient has trouble with loudness and has pitch range issues. One therapy program that may be considered for this patient is the A. APT program, B. LSVT program, C. FEES program, D. Laryngeal elevation program. Pause and think of the answer before the reveal. The answer is B. Flashcard 162. Which of the following is a direct approach to therapy for a client with dementia? A. Reduce the number of prepositions in a sentence. B. Discuss the present. C. Use advanced vocabulary. D. Use spaced retrieval training. Pause and think of the answer before the reveal. The answer is D. Flashcard 163. You receive a referral to assess Beth, who is a 76-year-old resident in a nursing home. The certified nursing assistants who work with her on a daily basis tell you that Beth has been experiencing changes in behavior. During group activities, she makes inappropriate comments and appears impulsive and distractible. The certified nursing assistants also note that she has decreased energy and motivation. You notice she is having mild problems with language as well. Which of the following forms of dementia is Beth displaying? A. Vascular dementia, B. Frontotemporal dementia, C. Lewy body dementia, D. Alzheimer's disease. Pause and think of the answer before the reveal. The answer is B. Flashcard 164. When working with individuals with dementia, a clinician can implement an approach which consists of accepting the values and beliefs of the individual, providing opportunities for the patient to convey feelings, and acknowledging any adverse perceptions and confusion of the individual. This approach is known as A. Space retrieval therapy, B. Cognitive modification therapy, C. Validation therapy, D. Environmental modification therapy. Pause and think of the answer before the reveal. The answer is C. Flashcard 165. Parkinson's disease is called a movement disorder because of the tremors and the slowing and stiffening that occur. The cells used to make dopamine are impaired in those with Parkinson's. Which of the following neurotransmitters is primarily responsible for controlling movement, emotional responses, and the ability to feel pleasure and pain? Pause and think of the answer before the reveal. The answer is C. Flashcard 166. You have completed the case history and assessment of a 72-year-old man and have found, among other things, inappropriate social behavior, excessive eating, depression, impaired judgment, and dominant language problems. The neurologist's report suggests dense intracellular formation in the neuronal cytoplasm. The most likely diagnosis would be which of the following? A. Dementia of the Alzheimer's type, B. Frontotemporal dementia associated with Pick's disease, C. Dementia associated with Parkinson's disease, D. Dementia due to Creutzfeldt-Jakob disease. Pause and think of the answer before the reveal. The answer is B. Flashcard 167. You are treating a 76-year-old woman with dementia. The patient presents with confusion. The patient's daughter informs you that she would like you to provide suggestions that may improve the quality of her mother's life. You suggest a therapy that would include orientation information. This would include providing the patient with information about time, person, and place. You mention to the daughter that this may improve an understanding and awareness of the environment. You also suggest that this information should be provided to the patient at fixed times throughout the day. However, you inform the daughter that there is no guarantee that this technique will work. This treatment method is an example of a reality orientation RO. B. Fast mapping therapy FMT. C. Simulated presence therapy SBT. D. Cognitive stimulation therapy CST. Pause and think of the answer before the reveal. The answer is A. Flashcard 168. You are treating a patient who has been diagnosed with Alzheimer's disease. You decide to use an emotion-oriented therapy by playing audio recordings of relatives of the patient. You believe that this approach will decrease the agitation and improve the well-being of the patient. This type of approach is called a reality orientation RO. B. Fast mapping therapy FMT. C. Simulated presence therapy SBT. D. Cognitive stimulation therapy CST. Pause and think of the answer before the reveal. The answer is C. Flashcard 169. Genetic testing is rarely conducted to predict the chance of developing Alzheimer's disease. One genetic test that is available directly to consumers to determine the primary genetic risk factor for late-onset Alzheimer's disease is A. R2D2B, IHOP-C, ApoE4D, OPA1. Pause and think of the answer before the reveal. The answer is C. Flashcard 170. When working with a client with dementia, a clinician plans on utilizing an emotion-oriented approach aimed at reducing levels of anxiety and challenging behaviors by playing audio recordings of the voices of close relatives of the client. This type of treatment approach is known as what? A. Montessori-based treatment. B. Reality orientation. C. Reminiscence therapy. D. Simulated presence therapy. Pause and think of the answer before the reveal. The answer is D. Flashcard 171. When providing intervention to an individual who presents with a social communication disorder, it is important to consider many aspects when considering treatment planning. Which of the following is not true? A. Treatment planning should involve consideration of variations in norms and values. B. Treatment planning should be based on norms rather than individual needs. C. Treatment planning should focus on functional outcomes. D. Treatment planning should involve the family and the individual. Pause and think of the answer before the reveal. The answer is B. Flashcard 172. Within Huntington's disease, there are two neurotransmitters responsible for controlling choreiform movements. Choreiform movements mimic dance. What are the two neurotransmitters lacking in a person with Huntington's disease? A. Acetylcholine and gamma-aminobutyric acid GABA B. Acetylcholine and dopamine C. Dopamine and gamma-aminobutyric acid GABA D. Gamma-aminobutyric acid GABA and serotonin. Pause and think of the answer before the reveal. The answer is A. Flashcard 173. A patient complains of aching pains, tingling sensations, and coldness. The speech-language pathologist's evaluation reveals that patient's voice is soft, breathy, and hoarse. Other symptoms include a mask-like face with slurred speech that sounds monotone. The clinician notices bradykinesia, rigidity, tremor, and impaired postural reflexes. Based on these symptoms, what would you most likely diagnose this patient with? A. Apraxia. B. Parkinson's disease. C. Vascular dementia. D. Huntington's disease. Pause and think of the answer before the reveal. The answer is B. Flashcard 174. You are treating a patient who has been diagnosed with early-stage dementia. You decide to use theme-based activities in a small group setting. You explain to the family that there is some evidence that this type of theme-based approach may maintain cognitive function in some patients with dementia. This type of approach is called a reality orientation RO. B. Fast mapping therapy FMT. C. External stimulation therapy ESD. D. Cognitive stimulation therapy CSD. Pause and think of the answer before the reveal. The answer is D. Flashcard 175 blank is the most common cause of dementia. It is officially diagnosed during blank. Pause and think of the answer before the reveal. The answer is Alzheimer's/autopsy. Flashcard 176. You are treating an 88-year-old woman with dementia. You introduce a treatment program to improve her quality of life. You begin your therapy by discussing past experiences and events in her life. You also use photographs of the patient's family members as well as music that she likes. You tailor the therapy specifically for the client by using objects and items that her son has provided to you. This treatment method is an example of a reality orientation RO. B. Reminiscence therapy RT. C. Simulated presence therapy SPT. D. Cognitive stimulation therapy CST. Pause and think of the answer before the reveal. The answer is B. Flashcard 177. This type of imaging may be used to diagnose those who have early onset or very mild dementia symptoms, usually under the age of 65, that may even be associated with severe depression. If the results of the test are positive, it indicates the presence of Alzheimer's disease. These scans are called A. Tau PET scans. B. Amyloid PET scans. C. Fluorodeoxyglucose FDG PET scans. D. Beta PET scans. Pause and think of the answer before the reveal. The answer is B. Flashcard 178. What dementia therapy technique is a shaping procedure in which the patient is asked to recall information over increasingly longer intervals of time? A. Reminiscence therapy. B. Repetition or direct priming. C. Associative or indirect priming. D. Spaced retrieval training. Pause and think of the answer before the reveal. The answer is D. Flashcard 179. A 72-year-old patient has been depressed since her husband passed away 2 months ago. The onset of her symptoms was short and abrupt. When memory was tested, she often stated that she did not know the answer to a question. Her attention and concentration appeared to be intact. However, she seemed upset and distressed during the evaluation. After extensive testing, the psychiatrist diagnosed the patient with A. Pseudodementia. B. Dementia. C. Pick's disease. D. Alzheimer's disease. Pause and think of the answer before the reveal. The answer is A. Flashcard 180. This is a common type of degenerative dementia in the elderly. Patients present with deficits in memory, loss of consciousness, and hallucinations. Patients will have a poor response to antipsychotic medications and may have repeated falls. A. Frontotemporal dementia. B. Vascular dementia. C. Lewy body dementia. D. Toxic dementia. Pause and think of the answer before the reveal. The answer is C. Flashcard 181. What kind of tremor is best described as an involuntary, rhythmic oscillation of one or more body parts, ranging from 4 to 12 cycles per second? A. Essential tremor. B. Voice tremor. C. Senile tremor. D. Familial tremor. Pause and think of the answer before the reveal. The answer is A. Flashcard 182. What type of dementia is categorized by loss of cognitive functions resulting from ischemic or hemorrhagic cerebrovascular disease? A. Frontotemporal dementia. B. Lewy body disease. C. Vascular dementia. D. Parkinson's disease. Pause and think of the answer before the reveal. The answer is C. Flashcard 183. Janine, an 83-year-old patient, is attending therapy for memory deficits caused by Alzheimer's disease. Janine's current goal is to use her techniques to recall a 3-point plot in a short video. Throughout the video clips, she talks about the plot. What direct intervention is Janine utilizing? A. Multimodal approach. B. Self-generated cues. C. Spaced retrieval training. D. Direct priming. Pause and think of the answer before the reveal. The answer is B. Flashcard 184. Amir is a typically developing young child whose family dog, Frieda, is a German Shepherd. When Amir's mother takes him to a local park, they spot a poodle and the mother says, "Look at that cute dog." Amir then replies, "That's not a dog. Only Frieda is a dog." Amir has just demonstrated the use of a N, A, overextension. B, underextension. C, reserved set. D, semantic category. Pause and think of the answer before the reveal. The answer is B. Flashcard 185. You have been asked to evaluate the speech of 4-year-old Maria. Maria's parents are concerned because, as they state, "We have a really hard time understanding her when she talks." Her preschool teacher says that he can't understand her very well, and neither can the other children. When you play informally with Maria, you see that she is highly unintelligible in connected speech. A more structured evaluation reveals the use of multiple phonological patterns. Which one of these patterns should Maria no longer be using now that she is 4? A. Fronting of velars. B. Stopping. C. Epenthesis. D. Gliding of liquids. Pause and think of the answer before the reveal. The answer is A. Flashcard 186. If a mother talks to her infant in utterances that are simpler, higher in pitch, and shorter than usual, she is using a pragmatic adjustment. B. Line of regard. C. Deictic language. D. Child-directed speech. Pause and think of the answer before the reveal. The answer is D. Flashcard 187. Which one of the following questions below would be an example of a tag question? A. Where is my kitty going? B. You want to play, don't you? C. Why can't I eat ice cream before dinner? D. When can I play my favorite video game? Pause and think of the answer before the reveal. The answer is B. Flashcard 188. You are gathering a language sample from a 6-year-old. You notice that his sentences tend to be quite simple and unsophisticated and that he uses mostly blank, which makes statements. A. Interrogatives. B. Declaratives. C. Passives. D. Constructives. Pause and think of the answer before the reveal. The answer is B. Flashcard 189. In Piaget's blank stage of cognitive development, children acquire seriation and conservation skills, employ logical causality, and use effective classification skills. A. Sensorimotor. B. Preoperational. C. Concrete operations D. Formal operations. Pause and think of the answer before the reveal. The answer is C. Flashcard 190. As children develop their language skills, they become more adept at blank, which has to do with the connected flow of language in conversation. A. Indirect requests B. Discourse C. Direct requests D. Using affixes. Pause and think of the answer before the reveal. The answer is B. Flashcard 191. During the first 3 years of life, a child's vocal tract anatomy and function mature. Which one of the following is not necessarily a sign of this maturation process? A. Lip closure improves B. The larynx moves farther up in the vocal tract C. Muscle tone in the tongue increases D. Tongue movements become disassociated with jaw movements. Pause and think of the answer before the reveal. The answer is B. Flashcard 192. The term blank refers to children's recognition, understanding, and use of word parts, for example, affixes that carry significance. A. Print knowledge B. Phonological awareness C. Morphological awareness D. Morphosyntactic knowledge. Pause and think of the answer before the reveal. The answer is C. Flashcard 193. You are observing Nathan, who is 18 months old. It is suspected that Nathan has severe developmental delays. When you listen to him communicate, you hear him producing strings of CV syllables. The timing of the CV syllables approximates that of adult speech. What prelinguistic stage is he currently in, and what is the average age associated with the stage? A. Cooing 4 minutes 6 months B. Jargon 10 minutes 12 months C. Variegated or non-reduplicated babbling 8 months 1 year D. Canonical or reduplicated babbling 6 minutes 8 months. Pause and think of the answer before the reveal. The answer is D. Flashcard 194. A 3-year-old child, Jesse, comes to you because the people around him are having difficulty understanding him when he talks. His phonetic inventory includes the phonemes /m, n, p, b, t, d/. Among other things, Jesse uses the phonological pattern of final consonant deletion. In therapy, the most appropriate target word to focus on would be A. Bath B. Whistle C. Bus D. Maid. Pause and think of the answer before the reveal. The answer is D. Flashcard 195. Which one of the following does not characterize developmental milestones that occur in typically developing infants between birth 3 months of age? A. Smiles reflexively B. Vocalizes predominantly vowels C. Begins marginal babbling with double syllables e.g. Baba D. Attends to and turns head toward a voice, turns toward a source of sound. Pause and think of the answer before the reveal. The answer is C. Flashcard 196. Antonio, a 20-month-old child, is enjoying his cup of apple juice. He finishes it up and says to his grandfather, "More juice." Antonio is demonstrating the use of A. Ahala phrase B. Semantic extension C. Overextension D. Recurrence. Pause and think of the answer before the reveal. The answer is D. Flashcard 197. As children develop their morphological skills, they need to eventually master blank morphemes, which include prefixes and suffixes, and change whole classes of words. A. Inflectional B. Prepositional C. Derivational D. Affixal. Pause and think of the answer before the reveal. The answer is C. Flashcard 198. Joey, a 5-year-old child, has been referred to you due to concerns about his language skills. You decide to gather a language sample to holistically evaluate his expressive language. At one point, during a game, Joey picks up a toy animal and says it has stripes and ate meat at zoo but no strawberry. This is an example of 11 words, 12 morphemes B 11 words, 11 morphemes C 11 words, 14 morphemes D 11 words, 13 morphemes. Pause and think of the answer before the reveal. The answer is A. Flashcard 199. A parent approaches you and asks if you will see her 3-year-old daughter, Kirsten, for language intervention. Kirsten's expressive language has been somewhat slow to develop. You evaluate Kirsten's morphological skills and find that she is consistently using the following morphemes: present tense ing, prepositions in, on, and regular plural s. As you begin therapy with Kirsten, which one of the following morphemes will you begin with next? A. Contractible auxiliary B. Articles the A and C. Possessive SD. Irregular past tense verbs. Pause and think of the answer before the reveal. The answer is D. Flashcard 200. Young children, in their 2-word utterances, frequently use semantic relations. A child who says that ball is using the semantic relation structure of A. Attribute plus entity B. Action plus locative C. Demonstrative plus noun D. Attributive plus noun. Pause and think of the answer before the reveal. The answer is C.